Thank you, Tyler. And the latest numbers make clear that COVID is still putting the state's hospitals in a terrible position. Across the state, there are only 43 available ICU beds out of 674 total. In Jackson and Josephine counties, there are only 2 ICU beds available. It's important to keep in mind this isn't a problem just for COVID patients. A lack of beds affects everyone that needs treatment at the hospital. The good news is that more help is on the way for hospitals in our area, in addition to the National Guardsmen that are already helping out. This takes us to Newswatch 12's Adam Shooms. He's been speaking with medics who are assisting hospitals around the state. He joins us now with an update. Adam?
Yeah, Alicia, good evening. It's no secret that hospitals around the nation are completely overwhelmed by the recent surge in cases. That is no different here in the state of Oregon, as more than 1,100 people are in the hospital tonight battling COVID-19. The situation is the same here in Jackson and Josephine counties. That is Region 5. There are 210 people in the hospital with COVID-19 across Region 5. 60 of them are in the ICU. This is hospital systems in the county continue to remind the community that their help is needed now more than ever to slow the spread of COVID-19. That's doing by the necessary things like wearing masks, face coverings, and getting vaccinated. FEMA representatives contracted with global medical resources to send representatives to the state to help with the ongoing surge. Counties in our region have received about 14 paramedics. They've been here since the 22nd of August.
At Global Medical Response, receive these requests from time to time. And our goal is to meet that need immediately. And what that looks like is that we mobilize both personnel, if necessary, vehicles and command staff to support these deployment requests. When our teams are deployed on behalf of FEMA, they arrive at their assigned destinations, and the caregivers work under the guidance of FEMA. They work under state and local guidance as well.
Matt said those resources come in the need of staffing, which is much needed, such as with local facilities and local hospital systems. This is all with the intent to take the burden off the hospital systems. They're expected to be here at the hospitals for about 30 days with an opportunity for extension. They're primarily serving in techs or support to techs in other floors as needed. Now, Matt said crews have been ready to respond at a moment's notice. Right now, they're getting word from FEMA that they're going to be here for about 30 days, give or take, but they're anticipating on staying longer if their number is called. This, as Matt says, the hospital systems right now are completely overwhelmed and their help is greatly appreciated. But for now, we're live in Medford tonight. I'm Adam Shooms, Newswatch 12.